Hi guys, my beloved students. Today's topic is heart failure. Take your pens, papers, and let's go. Chronic heart failure. So chronic heart failure, today's topic. So actually not topic, so your exams questions. And so if you find a question like this, what is chronic heart failure? So we understand, and NIA, you're right. Of course it has to be NIA. Means classifications, one principal classifications of chronic heart failure. But let's start with definition. So folks, let's go. Chronic heart failure is a progressive condition where the heart is failed to pump blood effectively to meet the body needs. This leads to symptoms such as fatigue, but principal, of course, is a shortness of breath, the principal complaint. Fluid retention, so-called edema, and exercise intolerance. So principal complaints, once again, shortness of breath, fatigue, fluid retention, edema, and exercise intolerance. So chronic heart failure can result from various underlying causes, but of course it's a line of metabolic syndrome, cardiovascular continuum. The principles are coronary artery disease, hypertension, metabolic disorders, cardiomyopathies, and valvular heart diseases, for example, congenital, or it might be mitral stenosis due to rheumatoid arthritis, and another congenital heart defects. But principal, of course, is a coronary artery disease and hypertension. Aging also it's a heart failure. So definition of chronic heart failure. Start by defining chronic heart failure as a condition where the heart is unable to pump blood effectively, leading to such symptoms, once again, shortness of breath, fatigue, fluid retention, and exercise intolerance. It's a principle. Causes of chronic heart failure: coronary artery disease, hypertension, and valvular heart diseases, cardiomyopathy is also. Symptoms, once again, I repeat it several times because might be, I don't know, separately questions. Symptoms of heart failure. Remember that the principal heart failure symptoms is it's a shortness of breath. Actually, shortness of breath equal to heart failure. Of course, not all shortness of breath are heart failure, but the heart failure's principal sign is a shortness of breath, dyspnea. Orthopnea, difficulty breathing while lying down, orthopnea, or paroxysmal nocturnal dyspnea, sudden shortness of breath at night. Nocturnal means night. Fatigue and edema, fluid retention. Of course, exercise intolerance. About classification, my beloveds, if it's me, I will ask this question, absolutely, about 9 classifications. So the New York Heart Association classification, NIA, sometimes you pronounce like NUHA, but actually correct, it's NIA, New York Heart Association. So it's a physical activity limitation. So class 1, no limitation of physical activity, means ordinary physical activity doesn't cause any symptoms, or everyday's activity. Class 2, slight limitation of physical activity, comfortable at rest, but ordinary physical activity results in symptoms for such patient, of course, for this patient, for this very patient. Class 3, marked limitation of physical activity, comfortable at rest, but less than ordinary activity causes symptoms. And finally, class 4, unable to carry out any physical activity without discomfort. The principle is a shortness of breath. Symptoms present even at rest, at any physical activity, and any physical activity worsens such symptoms. What symptoms? Shortness of breath, etc., etc. No principle, it's shortness of breath. Concerning clinical assessment and management, we have to highlight the importance of clinical assessment, including history taking, physical examination, laboratory tests, and imaging techniques in diagnosing and managing chronic heart failure. Emphasize the role of medications. No, if they ask the question, lifestyle modifications, well, it's a primordial lifestyle modification, and other interventions in managing chronic heart failure and improving quality of life. If asked questions about medication, why not? We start with diuretics. No, it depends. The diuretics, then AC inhibitors and beta blockers. Concerning calcium channel blockers, questionable, very highly questionable. No, diuretics, AC inhibitors, beta blockers. Complications, so we have to discuss potential complication if we have a time of chronic heart failure, such as arrhythmias, life-threatening arrhythmias, cardiogenic shock, and end organ damage. So we can briefly mention the prognosis of chronic heart failure if you have a time that can influence outcomes, such as comorbidities and adherence to treatment. Adherence to treatment, not only treatment, but adherence to lifestyle changes. Treatment, AC inhibitors, diuretics, beta blockers, etc. So, my beloveds, you have to understand that you have just several minutes on each question. So for this question, I talk 7 minutes, largely sufficient, largely. So God bless you. See you in another lectures.